Okay. Hi, we're recording, y'all guys. Hi, I'm Quisha. This is Abby, Cynthia,
Hi.
and Tanya. We're back again
Hi.
this week. We're back again this week with our internship vlog for you guys. And this week we'll be talking about the effects of COVID-19 on essential workers. This week we've interviewed a couple of people, a couple of essential workers, and we've done some research on how it has been affecting essential workers who are on the front lines, first responders, people in the healthcare profession, and just other professions who are required to work during this pandemic and they're not able to stay home like most of us have the ability to do. So first, I'll be talking about an essential worker that I interviewed. He works at a high school and he is doing e-learning with the students. So we talked for about an hour, and some of the things that he said is like some things that are affecting him is the fact that schedules for schools just keep changing. There's no set in stone rules because people just don't know. The teachers don't know. The administration doesn't know. So they keep changing the rules for the kids. They keep changing the rules for the teachers. They keep changing the rules for the TA as far as how e-learning is supposed to go, how homework and assignments and grading is supposed to go. And for those of you who don't know what e-learning is, it's electronic learning, which the kids go online and they either have like a meeting with the teacher face to face via the like Skype kind of thing or Zoom or whatever the teachers have, or they just get homework assignments online, or they have certain apps that they have to go on. I know for me, it's a mix of both for my kids. They meet with their teachers daily and they also do apps and they also have homework assignments. So one thing is that the rules and the regulations for that keep on changing. Homework turning in and being able to grade and interact. He told me one of the biggest problems he has is to actually get the kids to come to the e-learning, to actually connect with them, to actually get them to turn in homework, to actually get them to respond, because they're just at home and all the time someone is not pushing them to go and do that. And he said that another thing that is, he said that right now is causing a lot of stress in his field of work for the teachers and the students, because for a lot of students, school is a like a getaway from them. It's a breath of fresh air from certain situations at home. And some of the teachers know the home situations of some students. So it's adding an extra stress that you know that this home situation wasn't necessarily the best one. And now this student is home all day long and they don't have an outlet and they don't have a place where they feel like it's a safe haven. And teachers and administration and all those don't have the access to actually go to the student's home to do like well checks or to see how things are going at home. So you have that on mind too, like certain students may have been in abusive situations. So that is playing on a lot of teachers' minds too, as they're still trying to make lesson plans and they're still trying to figure out, going forward what life will be like. He is a TA. So another thing that he was saying is causing him stress is not knowing if his job is essential enough to carry him into the fall if the coronavirus goes over into the fall. And like has been predicted by the CDC that we're going to have another flare up in the fall. So worrying about, is your job essential enough to keep you on a payroll? That's a major stressor for people as essential workers in the facility that he works in, and like the school type of area. And then also we talked about trying to balance the life home life and work life, and just balancing all these things mentally and straining. I asked a question about has his place of employment offered any counseling, and as of he knows, they have not offered any counseling, and they haven't reached out to any of the employees except for giving them guidelines and rules about what they are expecting for them during this coronavirus. And he just said too, an added workload is because he's in a school and the kids are not all necessarily responding. They are having teachers and administration do more training. So it's like the adults are doing more learning than the children are, because to make up those hours, because he's still getting paid, he has to do online training. So for him, that's like a shift in his job. He's used to teaching and assisting, and now he's the one having to do hours of learning and trainings online. And one of the biggest things that he said that is bringing stress to his field of work and to him himself is that they have proposed that government workers will have to get certain vaccinations, like the coronavirus vaccination, in order to come back to work. That hasn't been like a bill that was passed or anything, but that was a proposal. And he's saying like it will be mandatory for them to do in order to return to work. And it's kind of not fair in his view, or my view, to force someone to get a certain type of, as an adult, a certain type of vaccination, when they may not believe in vaccinations, or they may not just want to do it. So that is a big stressor in that field. I don't know how far along that conversation about being vaccinated to come back to a government job has went, but as far as a school, I know it has been a conversation where this young man works. So along with just the stress of not being able to go outside, having to remember to social distance from the ones you love, like you just can't walk up and hug somebody that you see again, making sure you have your mask at all times, just trying to figure out if you're going to have a job next year is what is really stressful, or what that job will entail, or trying to figure out if you're going to be forced to take a vaccination. So he said to me that it's really having a lot of different layers of effects on his mental state, on his emotional state, because he's up and down because he wants to help kids, but he really can't reach them, and he really doesn't know. And then the job, and then home, and then he's worried about family. So on top of, just his own personal stuff, he has, the lives of others that he's worried about. And as of now, there's no real outlet for essential workers in that field. I can't speak for every field, but there's no real outlet. There has not been any like counseling support groups, even like stuff like this, blog groups where you can get on there and talk about things and release it. So right now they're kind of just in limbo. So that adds another level of stress, of course, to him. But that's all I had to say. So now we're going to go to Cynthia, and we're going to listen to what she has to say about it.
All righty. Thank you. Okay, so I also talked to an employee at Cook County Health and Hospital Systems, and she talked to several other people, and she feels that many workers feel a sense of uncertainty because employees are being threatened that they have this other system that's coming in to do their job, because we are a part of the revenue that brings in the money for the county. So she feels that. So the managers are threatening us, telling us that they got this new system that's going in to verify the patient's insurance, and that job is going to take over our job, and there's going to be layoffs and stuff like that, which we don't really have that much concern about it 100%, but then there's other people that's feeling kind of overwhelmed and having job insecurities because of it, because we don't know what's going to happen, but we do know layoffs are coming. And employees are faced with job cuts, and it has caused them to feel overwhelmed and a sense of stability about their jobs. Also, the young lady I interviewed, she said that she has a close-knit family, but she had to push her family back So she's stressed out about that because she's not able to do the things that she used to do. Like she used to go out for lunch and things like that, but now she has to work through her lunch and break. And or relatives and whatnot used to come and visit her, but she can't have that because several of her family members are not wearing masks. So she just feels unsure and unsafe about that. And so her husband had a pacemaker put in, so she can't invite anyone over that is not wearing masks or whatever, because she don't want anything to happen to her husband. And she's just feeling kind of overwhelmed and stressed about everything pertaining to that. Also, I interviewed another person. They don't work for the county, but they said that it's kind of overwhelming for them because they have that thought on their mind all the time that what if they get the coronavirus? I mean, that thought is on their mind every time they go in the store. They try to avoid people at all costs. I mean, it's just something they just think about every day, and they just don't want to just have that thought on their mind all the time. So I can see how that could be kind of overwhelming. And they have also come from a really large family, 13 sisters and 2 brothers, and they haven't been able to connect with any of their family members personally, face to face, just mainly over the phone. But to go from seeing your family all the time to not seeing your family, that can kind of like take a toll on you and everything like that. So and also, when I was doing some research, I see that also employees who have to care for their disabled children or elderly parents and grandparents are under extreme amount of stress because they have to, they are struggling to cope. Whereas they had someone somewhere, they have these different daytime, I think they call it like daycare places. They can send their grandparents, or they have special kind of schools that they can send kids with disabilities. So now they're not able to do that. And so now they, dealing with all that type of stress in their life. And so that's all I want to talk about. Thank you.
Thank you.
Yes, I have done a little research about the effects of mental health on essential workers. And what I came up with was that the pandemic is having a difficult impact on people depending on the previous life experience they have and the work settings that they're used to in their personality. There have been many signs of trauma with these essential workers. These traumas may have led to like difficulty of sleeping, changes in eating habits, nightmares, increased drinking or smoking, difficult concentrating, social withdrawal syndromes. They have feelings of depression and anxiety, and they also have increased irritability or anger. And some they're having basically intrusive thoughts right now about different going to be able to do what they can't do, how the future is going to be looking for them as far as a job, or how they going to be able to provide for them their families. Some people have households that are one income and they're no longer having one household incomes. They're waiting for unemployment and things to help some ways of feeding their kids. So they have a lot of intrusive thoughts. Some people have even experienced thoughts of suicide due to losing loved ones and basically feeling alone. And I know I know this lady right now that a lady I know, she's having suicidal thoughts because right now at this time she's a nanny. She's a nanny. She watches kids, but however, she doesn't have family. She doesn't have children. So right now she's feeling alone and she having these suicidal thoughts about killing herself. So right now is a lot of stress for her. Also increased sensitivity. On my research, I found out that the essential workers, 50% of them have depression, 45% have anxiety, 34 are dealing with insomnia, and 72% are dealing with psychological distress. And I also found out that women on the front line mostly have severe symptoms because of the emotional labor that they have to deal with, like keeping a steady stream of reassurance while suppressing their own feelings. So while they're suppressing their own feelings, they also have a lot of trauma that they not be able to actually identify with and express to others what they're feeling. So they're keeping it on the inside, and it's causing a lot of traumatic stress. It's causing a lot of stress, anxiety. It's causing a lot of social distancing, as far as like being disassociative with people, not wanting to talk to people. Basically, they're being home alone, staying to themselves, and they're becoming more depressed. That was all the information that I found.
Thank you.
Welcome.
All right. So I interviewed two people. I interviewed one of my friends who's a nurse at, I think she works at Payless Hospital. She told me in the beginning she was having horrible panic attacks because they were getting so many sick patients, and they were doing, she said, everything they could do to help them, and it seemed like nothing was working. And then she said they got a lot of help from nurses down south, and it was helpful because then she could, she said it was helpful to not come in on my days off and know that I wasn't letting my team down to not be there. And now she said she's just over it. She's a very like outgoing social person. So other than the interactions that she gets at work, and even that's like whatever she gets with her patients and then communicating with her coworkers about her patients, that's the most socialization she gets. So she said that's really hard. And then when I asked her like what she thought of some of the states opening up the way they are, and then the possibility of ours doing the same, she said, I think looking at the numbers, opening the states with lower amounts of cases would be helpful, and then doing it really slowly throughout the country. She talked about how she saw Pritzker opening Illinois in like those different phases. And she thinks that's really smart. She said other parts of the state really aren't getting hit like Chicago is. So opening them up before us would be smart to see if there is a spike. She said they have the hospital beds to handle it if things start to spread quickly. But like, whereas here, we just don't. And then she said she was praying that it doesn't happen into next year or go into next year. Because that would, you know, her being social, just not, it doesn't work with her. So she said she's hoping they come out with a vaccine, but even then she made the comment of there's a flu shot and not everybody gets the flu shot. So that was her concern too. And then I interviewed my sister, and she still has to go into work. She works at FedEx, or for FedEx in like the billing department. So she interacts a lot with truckers who come in and out. And I know before, in the beginning when it were, you know, there's only 2 or 3 billers that they had at the time. And then other people in the building, like she works night shift. People on day shift started dropping like flies. And then now there's only like 2 billers, and they actually had to pull people from other areas at her work to help them bill, because I think she said they had like 5 cases there already. So having 5 cases in that whole building, already being understaffed, and then being like scared that she's going to get infected because of all the contact she's having with truckers and all that, was just mentally draining. And then there was, we talked a little bit about the one point where before they told her that they might cut back on her hours, they were doing like these deep cleanings, and they were doing the deep cleanings while she was working. So then she's a little more sensitive to like chemicals. So she was really lightheaded when they were doing, it's like a waxer thing where they like scrub the floors really well. She was like getting lightheaded just sitting in there when they were doing that. So, and I think just last week she said they had another case where somebody came out positive with the coronavirus, but all they're telling the workers is that they're just deep cleaning the place and to keep doing your work and this and that. So she has a lot of anxiety over in that. And she suffers from depression. So sitting at home all day and then going to work to be terrified is just taking its toll on her. She's getting better, but it's still like, it still has a very heavy toll. And then I did like a little bit of research on like the mental health impact that psychologists think about all of this. And they were basically saying that anxiety and isolation are already in the works of affecting the public, and that I know we're all focused on like the coronavirus stuff, but they think it's really important that now we have like, there's a call for urgent research in just on mental health. Especially now with all the things we've seen on the news, I'm sure, about the domestic violence cases that are rising, and then the child abuse cases that are rising because all these people are stuck inside with each other and it's taking its toll. What was the other thing they said? They did 2 online surveys that had a snapshot of people's mental health, and they highlighted their concerns about accessing support and services during the pandemic. So a lot of people, they want the services and help, but they don't have access to it, or they don't have a way to get that. During the SARS epidemic of 2003, there was a 30% increase in suicide in the over 65s. So I believe people over the age of 65. And then it gave like a list of the most vulnerable groups, and there's 8. So there's children, young people, and families, because of school closures, domestic violence, and then no free school meals, which I know was a huge thing with my work. I'm also a paraprofessional or classroom aide, and like one of the biggest factors that even kept us from closing right away, like we probably should have, was there's 800 students in our school that receive meals. So they didn't want those kids to go without eating. So that was one of the reasons they were afraid to even close at all. And there's only like, I believe, 1,500 students in our school. So 800 out of 15 is just, it was too big of a factor. So that's one group. And then older adults and those with underlying health issues. And that's just because of isolation, loneliness, and bereavement. And then people with existing mental health issues, and that's pretty self-explanatory. Frontline healthcare workers, that's again really self-explanatory. People with learning difficulties, because that disrupts changes in routines and support. And like I know, also being our students that are in our program were really thrown off because they're so used to their structure and their schedules, and then when you throw them off, they're thrown off, and it's really just disrupting and distressing for them. So they started doing like I know it's like some online classes that we were invited to join with the kids, which has helped a little bit, but it's just not the same as like having a sensory room or getting to hang out with your friends all day. So People on low incomes because of job and financial security, prisoners, the homeless, and refugees. And then it says society in general might experience increased health inequality and a rise in use of food insecurity that we've seen over the past few months. So that's all I got.
That was great. Thank you, Abby. So, I know we're going a little bit past our time. I did have a question, because I did a little research, and they were saying like, well, just a statement, I guess, that having protective gear like mask and glove and hand sanitizer is important, but mental health right now is equally as important as protecting yourself physically, because this is a very stressful time, and suicide rates have went up as well. I've seen something on the news the other day where a young boy committed suicide because he just the pressures of being in the house all day. I don't know what the family background was, but that's just what the story was, that he hung himself in his closet. So we just want to be mindful of especially mindful of how it's impacting just people, and then the people that don't have the option to stay at home, who are considered essential workers. And it's not just the healthcare, it's not just teachers, it's grocery store clerks, it's food service people, all these people who are interacting with people daily and have fear of endangering their own family when they go home because they're interacting with people all day long. So we just want to be mindful and encourage people to seek some type of outlet, some type of mental health outlet, and whether it's talking to someone or even offer yourself as a outlet for people. Because I read this little sign that on Facebook, it says, I'd rather listen to your story than go to your funeral. Like, I'd rather hear you tell me whatever it is you have to say off your chest than hear that you committed suicide, So even if it's you lend people who are on the front line, just calling them, check on them, see, how they're doing, what's going on, how they're feeling, how is their mental health. Because a lot of people aren't forthcoming just to come out and tell somebody. But if you ask the question or you show concern, they might be willing to open up to you. So I just encourage everyone to do that.
Yeah, and I agree. True. I think just showing kindness to people when you go in the store, there's nothing wrong with giving them a little smile or asking them, how was your day? How are you doing today? That might make a world of difference to some people, because they so used to getting people that's grouchy or mean or giving them attitude, and right now they don't need that.
Yeah. I would deliberately, like, I'm not regularly like a mean person anyways, but I'm deliberately even more kind to people at the stores. I'm like, you have a great day, stay safe, because we don't really know what you can touch something and then touch a face and have the coronavirus. We don't really know what it takes to get it, like right. It could be anything. Right. It'd be the simplest act. So just being kind and I found that telling people to stay safe is like really, people like, thank you, like, just stay safe, it's a lot out there. So we want to be extra prayerful for our essential workers. Like, it's stressful out here dealing with this, your home life and your job life, where you got to go every day and deal with other people and deal with your own mental issues. So as we end the video, I do want to say to any viewers, if you're an essential worker, please add anything that you would like to add in the comments below. Let us know how you're feeling, how you're dealing with the COVID-19 situation, your mental health. What outlets have you found that work for you? And also let us know what you think about what we said in the video and the things that we've heard from other essential workers or from our research. Thank you for watching, and that's it from us. Thank you. Bye.
Have a good night.
Bye.
Thank you.